Does Planned Parenthood actually provide the reproductive health care services that leftists claim it does? No, it doesn't. And I want to break that down today. But to start, I'm going to play a clip from Representative Alexandria Ocasio Cortez talking back in June about a bill that was put forth in the House to defund Planned Parenthood. And I want you to listen closely to the language that she uses to describe Planned Parenthood.
Mr. Chair, we've been here since 2 o'clock yesterday, straight, no breaks, discussing everything from the energy provisions that are being gutted to, most importantly, healthcare that is on the chopping block. And for a lot of this discussion in the last almost 24 hours, some of the justification for these cuts have been about populations and people who are undeserving of Medicaid and health care, who are not worthy of it, who are fraudulent, et cetera. The list goes on. But, at the end of the day, it's about who is not deserving of care. And I would like my colleagues to sit with the feeling of having this legislation come before us and imagine what it feels like as a woman to have health care and clinics that are dedicated to the full spectrum of women's care be on the chopping block.
Okay, so right off the bat, she is framing Planned Parenthood as an institution that provides healthcare services specifically to women, and that this is an essential service and that women are deserving of healthcare. So it's framing the conversation as if women are somehow undeserving of healthcare if Planned Parenthood were to be defunded. So the equivocation of Planned Parenthood and healthcare is very important here.
Because the implication is that we are undeserving. The implication here is that Planned Parenthood is being defunded because women are undeserving of the full spectrum of care.
Full spectrum of care. So what does that mean? So reproductive health is not just about pregnancies. And when you think of Planned Parenthood, you're thinking of abortions, you're thinking of pregnancies, right? Full spectrum of care includes everything from when a preteen girl begins her period all the way up through menopause. So the point where women are no longer able to bear children, right? That would encompass the full spectrum of care. And there's lots of stuff in the middle there. There's annual checks you have to do for screening for cervical and ovarian cancer. Now there's a vaccine you can get for cervical cancer. I have opinions on that, but that's a separate conversation. There's preventative care. Once you hit a certain age, women start getting mammograms to screen for breast cancer, and so men have the same type of screenings, right? You go to the doctor and you'll get screened for prostate cancer and all sorts of stuff, right? So there's cancer screenings just to prevent any sort of complications that affect your reproductive organs. Reproductive health care, in my opinion, should also include understanding that the cycle that your body is on. Like, I'm speaking from experience here as a millennial woman, similar age as AOC here, who's gone through the public school system. Healthcare classes in high school didn't really teach us anything about our reproductive health. I remember units on family planning and prevention. So it wasn't like an abstinence-based curriculum, but definitely start thinking about family. So framing things in the context of family, and here's the types of protection you can use, right? So that's pretty much the only education I got in terms of, here's your body and here's how it works. But for women, we're on a cycle. You can predict and plan when your body is going to be the most fertile. So right from the get-go, like the easiest way to plan an unwanted pregnancy is to not have unprotected sex when your body is ovulating. And that means when you release an egg, that could potentially become fertilized. Okay, that's basically what that means. So the easiest way to prevent this is just don't have sex during certain periods of time of the month. Very simple. But so that would encompass, the full spectrum care that she's referring to here. Learning about that, because we're not taught that in school, so you're going to have to learn that either on your own or through consultation with a healthcare provider. Once you are pregnant, right? There's a whole, even that is a whole journey, right? Some women struggle with fertility issues. PCOS, which is polycystic ovarian syndrome, I believe, that's a big issue that women are dealing with. A lot of that has to do with diet and exercise, unfortunately. But that has affected how women are able to conceive. So there's issues that women have to grapple with in terms of conception. And then once you successfully do conceive, then of course there's the prenatal stuff, and there's counseling and different types of services you can get. It's not just like the medical stuff. I think people think it's just, medical stuff, but there's a lot more to it than that. Okay. And then of course there's like the actual process of giving birth and figuring that out. And then there's the postpartum phase where your body has to heal and recover, and you have to learn how to be a mother. And so there's all sorts of different services that are available, both, privately funded, but also publicly available, to help all sorts of different women on this journey. And then of course, as you get older, you're going to go through menopause. And so there's going to be changes there. Your hormones are going to be out of whack. So the full spectrum of reproductive care is far more reaching than just like getting pregnant and having an abortion. It fundamentally is just about women's bodies, and much the same way that, men have different issues with their bodies too. And there's things that, you have to consider, and, testosterone levels and all that kind of stuff, right? So we have different biologies that require unique medical care. Women are kind of special in that we can create life, and that requires some special attention to it. But the claim that she is making here is that women deserve full spectrum care, yes, and that Planned Parenthood is a service provider that provides that full spectrum
care that can save their life. Because as the gentlelady from Virginia noted, in states that have banned, outlawed, restricted, defunded abortion services and care, women die at much higher rates. It kills women. It kills women to defund care, reproductive care. It kills women to restrict it, to ban it, to defund it. And this legislation will kill women. That is not a hyperbole. It is not a hyperbole. Pregnant women can enter complications really fast, really fast. And in many places, in many communities, a Planned Parenthood clinic is the closest, only, and most available place that a woman can go to for care.
Okay, so I can't speak to the full details of what a Planned Parenthood facility has inside their offices. I have been to 2 separate Planned Parenthoods for just like simple basic services. And my impression I got is that they're not fully equipped to deal with this sudden severe complications that would arise during pregnancy that AOC is referring to here. My understanding, I don't believe, to my knowledge, that Planned Parenthood clinics are equipped with like surgical facilities. Some might be, but I don't think all of them are. The ones here in Austin, they're just in like strip malls and like next to, a Mexican restaurant. I don't think that is necessarily going to have like sterilized facilities you would need for acute medical care. So someone correct me if I'm wrong. My understanding is if you have a complication from a pregnancy, you're not going to go to a Planned Parenthood. You're going to go to the emergency room because they're going to be the ones who are equipped to help you out. And complications take different, take different forms, right? But there's one is a good example is, I'm going to pronounce this wrong, metiscus. It's after you give birth, when you're in the process of breastfeeding, your breast can become infected. And so that can lead to sepsis, and that can be very dangerous for a woman. Like if that happens, like Planned Parenthood isn't going to be my first choice. I'm going to go to the emergency room, right? So again, here she's trying to appeal to emotion, arguing that defunding Planned Parenthood is going to kill women. And she's making the argument that Planned Parenthood is a full spectrum healthcare facility. When in many cases, yes, these Planned Parenthood facilities do have doctor's offices, and some might be equipped with like light surgical equipment, but they're probably not going to have the expertise or the personnel or the facilities to manage an acute complication that's going to come from a problem with pregnancy. Like they're more likely than not probably going to encourage you to go to the emergency room.
My own mother got prenatal care for me at a Planned Parenthood. All of her ultrasounds, all of her prenatal care was at a Planned Parenthood. And without a Planned Parenthood, I don't know what kind of care she would have gotten. Women who are menopausal are getting hormone replacement therapy, helping ease an enormous amount of pain in their life, an enormous amount of discomfort in their life. Young women are learning about the reproductive and birth control options that are available to them.
Pay close attention to what she just said. Young women are learning about the reproductive options that are available to them.
People are figuring out what to do in terms of what to avail themselves. The point has been made many times that abortion is not the only service that's provided by Planned Parenthood, but it is a critical one. Because in the event where a woman's life is threatened and a D&C is the only option that you have to save her life, defunding a Planned Parenthood will take her life. And this provision that defunds Planned Parenthood is telling every woman in the country that you are part of an undeserving class, that you are part of waste, fraud, and abuse as a human being. And we do not believe that women are disposable in this country. We do not believe that our lives are disposable at all, whatsoever. You know, earlier today and earlier this evening, I was chastised for looking at a camera. I was told to look at my colleagues, and I'm looking over and none of them have been looking at me in the eyes this entire time. Our lives matter, and we are worthy of respect. Please vote for the gentlelady's provision that eliminates this deeply harmful rescission that will hurt the women in your communities. And with that, I yield back.
Okay, so this is the general talking point for leftists, and this is the appeal that they make. They make an emotional appeal that women will suffer and they will lack access to reproductive health care services if Planned Parenthood is defunded. So I want to go through and debunk that because I think it's absolutely incorrect. So this is Planned Parenthood's website. It defaulted to Texas because that's where I'm at, but it might be a different elsewhere where you are. So just look at the top here. So for patients, the first, like when you click on the drop down, you can make an appointment. It has healthcare services. Abortion has its own special call out. Telemedicine, info for teens and parents, gender affirming care has its own call out. You'll notice here, there's nothing about just reproductive health. There's nothing about prenatal care, right? Like she says, she made the claim that abortion is one of many services that Planned Parenthood provides, and that it's a full spectrum healthcare provider. Well, from just basic website design and navigation, right off the bat, they have singled out two services, abortion and gender affirming healthcare, as the primary services that they're providing. If it were true that full spectrum healthcare for women was important, they would also have call outs for fertility, just general counseling, prenatal care. They do have something here for menopause, so that's a good thing. But you'll see that there's a clear deficit of, a shortcut to getting to the prenatal care. So it's clearly not what their priority is. So let's scroll down here to just show you like more of what they have. So they offer what they claim are healthcare services, which we'll dive into a second. They provide birth control, so you can get all sorts of birth control there. You can get STI testing and treatment, Frankly, that is part of sexual health, not necessarily part of reproductive health, even though it does entail the reproductive organs. Obviously, here in Texas, abortions are no longer legal, so they don't provide that. They talk about insurance and payment options, and I think this is really important. So AOC makes the claim that by defunding Planned Parenthood, women in communities that are served by Planned Parenthood will suffer, they will die because they'll lose access to reproductive health care. The implicit assumption there is that Planned Parenthood's only source of funding comes from the taxpayers, from the federal government. And that's not true. Planned Parenthood solicits donations just like NPR, just like the Sierra Club, no different. They solicit donations. And then when you go, you have to pay with insurance. Like they don't just have free healthcare. And I'm saying this, I've gone twice now. And my most recent time, they ask for your income because if depending on what your income is, you might qualify for a subsidy or a discount on services. So I went as a self-paying patient, and they asked me what my income was, and at the time I had just lost my freelance income, so I gave them a ballpark of what I had made up until that point in time, and so I was like, just $3,000 a month, and at $3,000 a month gross income, so income before taxes, I did not qualify for any sort of financial benefit from Planned Parenthood. I had to pay 100% of my simple procedure out of pocket. It was a 5-minute procedure. Had to pay 100% of it out of pocket. So it's not like you're going to get a discount, right? If you're struggling to find healthcare services at a normal OBGYN because you don't have health insurance, you have really bad health insurance, that doesn't mean Planned Parenthood is necessarily going to help you either. I think $3,000 a year or a month annualized is $36,000 a year. Like that's not a good income. Okay. So if that doesn't qualify you for their services, like I think they probably use the poverty line, right? So it's a very small number of people that are actually going to qualify. The average middle class household probably isn't going to get the benefit they think they're going to from a Planned Parenthood. So it operates like a normal doctor's office. They bill your insurance, they collect payment there, and then they're soliciting their advocates for donations. So the government isn't the only source of funding for Planned Parenthood. And then, of course, they also provide gender-affirming care, which is hugely problematic. It completely dilutes the purpose of Planned Parenthood. Again, AOC claimed, this is all about women. We're supporting women, that women deserve health care. Okay, well, how can women possibly get health care if biological men are allowed access to the same healthcare services? They just have to put on a dress, wear some makeup, and walk into a Planned Parenthood clinic, call themselves a woman, and they get access to the same reproductive healthcare services that I, as a legitimate biological woman, should otherwise have access to. It's deeply unsettling. And there was a different point in time a couple of years ago where I went to a clinic and I did encounter a trans person in the waiting room, and it was uncomfortable. I was asked to provide my pronouns when I checked in, which I said I didn't have pronouns, and the person behind the desk proceeded to assign a gender to me. She assigned me as woman because obviously, duh. But then there was, I was waiting in the waiting room with a biological male, and it dawned on me like, okay, if Planned Parenthood is so important, if the funding is so important, if there's scarcity and access to these medical services such that like we need to fund these clinics, why are women competing with men for access to these services? That's the problem I have. It's clearly no longer for women anymore. So right off the bat, like I have some problems here. Okay. And then you go all the way here to the bottom. And the only thing, like this is kind of tucked away at the bottom. A lot of people don't scroll to the bottom of websites. That's why I'm calling this out, is their period tracker. So tracking your period is kind of important. It's something all women should do. That's how you know if you're pregnant or not, is if you miss your period or if you have other complications too. It's not just that. And I think people forget that. Like I run, I mentioned this in other videos, I'm a runner. So I've had issues a long time ago, but issues where I missed a couple periods because of running and stress on my body. So if you're an athlete and you put a lot of stress on your body, it can change your cycle. So it's really important to keep track of your period because you want to know if something is out of sync. Like it's a way, and much the same way you would measure your temperature if you think you have the flu and you're sick and you want to know if you have a fever. Like, women should be tracking their periods to know like that everything is okay in their bodies. And the fact that this isn't normalized, this is not, I think with apps it's gotten more common, but it's not normalized as much as I think it should be, is in and of itself a problem. And so the fact that this is tucked all the way at the bottom tells you this is not a priority for Planned Parenthood. Clearly, getting gender affirming care and abortion services is more important of a priority for Planned Parenthood than helping women track their cycles. Okay, so let's go to patients and let's go to healthcare services here. So you click on healthcare services, and this is what they provide. These are the appointments you can book at Planned Parenthood. So right off the bat, you can get an abortion. Obviously, certain facilities you can't do that anymore, but you can get an abortion at Planned Parenthood. You can do an annual wellness exam, and this is important. This is what women get annually, and I think men probably have a similar thing, but just to make sure everything's okay. But here again, the priority here is birth control, STI testing, but there's nothing that talks about like fertility, or if you are planning on becoming pregnant, or if you want to become pregnant. Usually these exams are places where you would talk to your medical provider about that kind of stuff. It's not an option there. Birth control, so you can go to Planned Parenthood and get whatever birth control you want. Notice fertility tracking and tracking your ovulation cycle. Not part of birth control. There's no like natural birth control options here. It's all, IUDs and pills and that kind of thing. And so that's what they offer. They'll do breast cancer screenings, which I do think are important. And I think this could indeed save lives. So absolutely. I think like definitely like women need to have access to this. And if you don't have health insurance, making sure that you have access to cancer screenings, I think is really important. Same with cervical cancer. They offer that as well. And like I said, this is part of your annual, this is typically part of your annual wellness exam. But I will say, I don't know beyond this if they offer any sort of like supplemental care. So for example, if your screen comes back with an anomaly, or if it comes back abnormal, I don't know what additional care that they will provide you with. And that can happen. It doesn't necessarily mean that you have cancer, but there can be abnormalities that your doctor will want to check and retest you every, periodically, right? Rather than annually, maybe every couple months. So I don't know if they provide continuity of care after you have your wellness exam. So that's an important question. Gender affirming healthcare. Okay, so like I said, this is supposed to be for women, right? Planned Parenthood is supposed to care to women, but biological men can go and receive healthcare services from Planned Parenthood. And again, I don't know specifically what this entails, but there was someone who went undercover and pretended to be a teenager calling Planned Parenthood to get access to hormone treatment. So I suspect that's probably what they're providing here is hormone treatment. Of course, you can get HIV services. You can get hormone replacement therapy for menopause, which again, not necessarily a bad thing. I think this is probably pretty important. But you'll notice too, the focus of Planned Parenthood isn't really women over the age of 40. You don't really see elderly women going to Planned Parenthood for services. Usually their target demographic are going to be teenagers and young adults who aren't married and maybe have had an unplanned pregnancy or looking for birth control. I suspect that's the majority of who they're caring for. And then obviously low-income families who do qualify for whatever free assistance they provide will go there for prenatal care, whatever prenatal care they provide. That's who they really cater to. They don't cater to people who have health insurance through an employer or through the exchange, and they don't really cater to older women. So yeah, they offer this. I'd be curious to know what percentage of their service, like the services they provide, actually go to perimenopausal and menopausal women. Emergency contraception. So again, this is another form of terminating a pregnancy, an unwanted pregnancy. And I believe now a morning after pill is available over the counter as well. They offer pain management. And so this is for inserting IUDs and inserting birth control. That's that. Like I said, the test to screen for cervical cancer, pregnancy testing, and options counseling. Okay, options counseling. So this is what they have for pregnancy. So if you think you're pregnant, you can go, they'll give you a test. They'll give you referrals and information so you can pursue parenthood, abortion, or adoption. Select Planned Parenthood services also provide ultrasounds to determine how far along you are in your pregnancy. Notice select, so not all provide ultrasounds. So it's quite possible that you could be pregnant, and maybe AOC is right. Planned Parenthood is the only clinic in your community that services women. But if that facility doesn't have an ultrasound service or doesn't have any of the other equipment you would need to monitor a growing fetus, well, what good is it? So it's very clear, like, this isn't, necessarily the priority for them. Of course, we have STI testing and treatment, getting treatment for UTIs and vaccines. So HPV is the big one. Okay, do you see prenatal care on here at all? Do you see any information about, okay, you're pregnant. Here's how you get prenatal care. Here's what you're going to need to do. Here's how ultrasounds. They mention here, they reference potential access to ultrasound services as part of their options counseling, but they don't in and of itself provide you with the option to go to Planned Parenthood and just schedule an appointment for an ultrasound. There's no sort of counseling at all. They say there's counseling here, but there's no counseling about even giving birth. So you can give birth at a hospital. A lot more women are starting to do it at home. You can hire a doula. You can work with a midwife. You can work with an OBGYN. When I think of options counseling, like, I'm thinking of options like that. But when they're talking about options counseling, they're talking about the option of whether or not you're going to keep the baby or you're going to kill it. Okay. There's nothing on here about fertility treatments, right? I said polycystic ovarian syndrome. That's a huge problem that's affecting a lot of women right now. That's an essential healthcare service that women need, especially women who do want to start families and they are struggling with fertility issues. There's nothing on here about that. And there's nothing about, like, learning about your cycle, just naturally planning. There's nothing about family formation here. So this very clearly tells you just how their website is laid out, what their priority is. Their priority is not the full spectrum of reproductive health care. They do not want to service women. They want to make it easy for you to terminate your pregnancy. And you have to think again of the demographic they're serving. They're largely serving poor people. They are serving young teenagers and young adults, so single women, women who aren't ready to have kids and want an out. They're serving those same women to help them get birth control. And this makes sense because Margaret Sanger is one of the founders of, I think she's the only founder of Planned Parenthood, but she was part of the eugenics movement in the United States in the early 20th century. And Planned Parenthood and birth control was originally designed to curtail reproduction within minority populations in the United States. So Margaret Sanger didn't want Black women to reproduce. So that's where Planned Parenthood emanated from. That's where birth control came from. It was all about terminating undesirable, at the time, it was undesirable pregnancies. Now it's about terminating unwanted pregnancies, and it's heralded as liberation for women. And now, you see leftists like AOC who are like, okay, well, this is, essential. And if you don't agree with this, women are going to die. So you can see it right here, like Planned Parenthood is completely full of malarkey. Women cannot get the healthcare services, the full spectrum services they need. Now, let me give you a comparison, just so you can see the difference here. So this is the Vitae clinic. This is an OBGYN clinic here in Austin. This clinic is affiliated with the John Paul II, I forget, the one Pope, Life Center here. And so it is affiliated with the Catholic Church, loosely affiliated, and it does follow faith-based teaching. So as a comparison and a contrast to Planned Parenthood, this is what a religious provider would provide. And then obviously in the middle, like, you can go to any healthcare provider and they'll provide healthcare services you need without any sort of judgment. So here you see their drop-down bar. Okay, so they provide obstetric care, they provide gynecology, natural family planning, infertility, and hormone therapy. So they provide the hormone stuff that Planned Parenthood provides, but they also provide all this other stuff too. So obstetric care that I think is prenatal stuff. So they're providing that. So right off the bat, that's something that Planned Parenthood doesn't overtly provide. Gynecology, that's like kind of the same thing, like the routine exams. So Planned Parenthood does provide this. But it also talks about premenstrual syndrome management. So that's something also Planned Parenthood didn't mention is a lot of women deal with PMS, and that can vary from woman to woman. It can be anything from like really intense cramping to heavy bleeding, nothing at all, mood swings, all sorts of stuff, right? So that's a core part of women's healthcare. Managing your PMS is a big deal. Obviously, they do STD screenings, the pap smears, and the cervical screenings, breast and ovarian cancer screenings, urinary incontinence. Another thing that affects probably older women that Planned Parenthood is not providing whatsoever. And then, of course, they go down. They also offer services that range in complications of the reproductive healthcare system. So like I said, polycystic ovary syndrome. They deal with endometriosis, which is another issue that affects a lot of women, ovarian cysts, painful periods, abnormal and irregular cycles, incontinence, all that kind of stuff. So when you go, like you can get all of this stuff done. Notice like even Planned Parenthood doesn't offer hysterectomies, right? If they really offered the full spectrum of healthcare services, you would think they would offer hysterectomies, and they don't. They don't provide any of this stuff, right? So they're not. They can't do like the surgical stuff that they claim that they can. So that's your basic OBGYN stuff. Okay, family planning. This is kind of what I was talking about, but a calendar method or rhythm method. It's basically learning your body's natural cycle, and this isn't like crazy cuckoo woo woo stuff. Like this is pretty normal. Like you can track your cycle down to the day and figure out then if your body's going to get if you're gonna have an egg and whether or not you're ready to have kids. If you are, then go forth and try. If not, then don't do anything. But that's what they offer that service there. So they offer far more counseling and support in terms of helping you plan a pregnancy, helping you overcome just general issues that affect women. And then, once you are pregnant, like making sure everything goes okay. Okay, so they offer infertility treatment, which again is a huge issue right now. A lot of people are struggling with infertility for myriad reasons. So they offer support with that. I don't really know what support Planned Parenthood offers with regard to infertility treatment. I don't believe, did they? Infertility. Yeah, infertility is not even on here. So they don't even offer infertility treatment. And then, you have hormone therapy, which again caters to older women, which are very clearly left out of the Planned Parenthood services. So this is just like an example. And again, yes, this is going to be a faith-based center, so they are going to prioritize advocating for women to continue with their pregnancies. They're not going to provide termination services. But this is the type of care you could expect at most normal like OBGYNs, most doctors' offices. Even if you just go to one that's completely unaffiliated with any sort of religious institution, like you're going to find a lot of these same services. So this is reproductive health. This is what full spectrum reproductive health looks like. It's from being a teenager all the way up to your older years, making sure that you are taking care of your cycle and your reproductive organs, making sure that everything's working okay. If there's problems, taking care of those, screening for cancer, and then preparing you as you go through different phases in life. So those phases range from, being a single young woman and being responsible and learning how to be responsible to becoming a mother and learning how to, go through that process to, aging out of your reproductive period of time and adjusting as your body changes and your hormones change. Like that's the process. And Planned Parenthood does not provide any of that. So this is why I think it's highly problematic that leftists like AOC claim this is about healthcare, because it clearly isn't. Like if it was about healthcare, Planned Parenthood's options and the services they provide would more mirror this. It just wouldn't be religious focused, right? It would be a very secular, neutral option for you to pursue. But the fact that you go to Planned Parenthood's website and right off the bat, you just go to the drop down bar here, and abortion is one of the primary things you can get, as well as gender affirming care. It really tells you that this is a politically motivated organization, and it's an organization that prioritizes terminating life rather than supporting the needs of women. So that's what I have for you today. If you enjoyed this analysis, I would love it if you'd like and subscribe. Definitely share this with any female friends in your network who are convinced that Planned Parenthood is great, because they may not have been exposed to this, in all honesty. Once you're in like the feminist hive mind, it's really hard to get out. So the more women are exposed to messaging that disproves that narrative, I think the better off all of society will be. So definitely share it with them. Otherwise, I'll see you in the next video. Thanks again for watching.